when you're in your mother's womb, there is a definitive fixed amount of eggs that are there, which you inherit, which are in your ovary. And after the puberty, every cycle, many of these eggs, they grow and they get destroyed on their own. It's called atresia. So because of that, every month, slowly the ovarian reserve falls down. And at a point in time, somewhere between the age of 40 and 45 or 50, when there is very little eggs in your ovary, then at that point you will stop getting your periods, because low AMH means less eggs in your ovary, less egg means less estrogen, and at one point in time when the estrogen output from the ovary goes down, you suddenly become menopause. So that is a natural process. But if you do get it if you get a menopause before the age of 40, it is known as premature ovarian failure or premature ovarian insufficiency. And many of these patients, they start having low AMH right from beginning before the age of 35. Now, if there's a low AMH before the age of 35, we need to look at the causes. So most of the time, there is no cause found. But in our country, one of the big diseases that can cause low AMH is tuberculosis. So that genital tuberculosis can damage the ovary and eat up the ovary, and that can result in lower ovarian reserve. The other common cause which has been seen nowadays amongst our lifestyle is changing is endometriosis. So if you have an endometriosis also, especially there's an ovarian endometrioma, that also can eat up into your ovary. Or whenever you have such endometrioma, many times the surgeons, they go in and they try to remove the whole endometrioma. In the process of removing the surgery, they also remove normal ovarian tissue. And that's how the ovarian reserve goes down. So, and then there are other things like you may have a genetic problem which is called a Turner's syndrome or a Turner's mosaic, or sometimes you may also have a genetic disease called a fragile X syndrome. A fragile X syndrome, patients also, 4 to 5% of fragile X patient syndrome patients, they manifest as a low AMH. Sometimes if you have a thyroid inflammation, thyroiditis, that can also cause low AMH. But overall, if you investigate the patient, majority of the time you don't find any reason for low AMH, and most of the time it is called idiopathic, means we can't find a cause. So it's just genetically programmed that certain women have a tendency to go for a earlier kind of depletion of their eggs, resulting in earlier menopause.